Can you tell us what you would recommend to a mom who has a kid who plays contact sports?
Depending on the sport, making sure you have good technique. So, specifically in football, we want to make sure kids are being coached by coaches who have training, right? Not just like Joe from down the street, because there's special training, for tackling technique. We don't want kids leading with the round of their head. That puts a lot of strain on the spine. We want to make sure that kids are tackling correctly. Things happen, things that we can't always expect, and things happen really fast. So we can't always prevent everything.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Hi, everyone. Welcome to another episode of the Care Room with Dr. Cindy. Today, I have another exciting episode for you. We have Dr. Kiyomi Goto with us. She is an excellent family doc. She's also certified in sports medicine, and she's here with us today to share her wisdom. But before we get started, I'll just let her introduce herself. It's all yours, Dr. Goto.
Hi. Aloha. I'm Kiyomi. I work as a family physician in Hawaii. I also do sports medicine. So, as part of my job, I also help with team coverage for one of our local high
Nice.
schools.
Nice. So, Dr. Goto, can you tell us more about what it's like to be a sports medicine doctor? Do you get to meet all the famous sports athletes?
I do not know any famous athletes. I do think, like during my fellowship, I did fellowship at a Division 1 school. So we do have some football players and other athletes who have been in the Olympics or play in the NFL, but I can't say that I
Okay.
know them.
Okay. We were looking to see if, we could get introduced to, like probably like Steph Curry or,
I wish, I wish.
my son would love you forever if you could make that happen for him.
Yeah, I'm not that famous either.
So I know one of the things that we family docs we deal with a lot is concussions. So I'm happy that you're here because it's always this question from parents like, okay, they reach out, something happened at school. My son, he was at probably like, basketball practice, or we have a lot of patients who also play football. He hit his head. But their main question is like, should I come in? Does he need to be seen? Can you tell us more about when a mom, because a lot of our listeners are moms, should bring in their kids for a concussion
Yeah,
evaluation?
yeah. Yeah, that's a great question. So, concussion is essentially a form of traumatic brain injury. And you don't actually have to have a direct hit to the head. You could have maybe whiplash, where you kind of go forward and backwards, and your brain is sitting in fluid in your skull, and the brain actually moves inside the skull and can hit on the inside of the skull, causing injury. And that can cause a lot of different symptoms like headache, dizziness, irritability, difficulty focusing. And most schools, particularly high schools, will actually have athletic trainers on
Okay.
staff. So the athletic trainers are often the first folks to evaluate someone for concussion in a school setting. Now, if you're, doing community sports, that may not be available to you. But I think anytime anybody has symptoms of a concussion, you should definitely be seen by a doctor because you never know. There's things on exam that we pick up that you might not have even noticed or you thought, oh, that was just
Right.
normal. Um, and just because it's common doesn't mean that that it's normal for you.
Sure, sure. So can you tell us
Yeah.
more about those symptoms? Like what would I look out for if my son, that happens at school?
Yeah, so headaches are really
Sure.
common. Difficulty concentrating is maybe a little more subtle because maybe little kids have more difficulty concentrating if they're asked to be sitting still, anyways. Dizziness is really common. Light sensitivity or noise sensitivity kind of sounds like a migraine
Right,
almost.
right.
um, Difficulty sleeping, irritability, feeling like things are moving around them. Those are really concerning symptoms. Obviously, if your child has numbness or tingling in their arms or their legs, that's very concerning, and probably just really skip the primary care doctor. And you probably need to be seen by the
Okay.
emergency room because those are concerning for like a neck
Sure,
injury too.
sure. And
Yeah.
what if he's the star player and I need to get him back in? I mean,
Yeah.
like we're thinking about that college scholarship.
Yeah. Yeah. I hear this a
Mhm.
lot, right? Most concussions average take about 2 weeks to get completely better. That being said, a lot of kids are get better sooner. Some kids get better maybe longer than that. I think people should have no symptoms or be back to their baseline. So, say your kid has ADHD, right? So they at baseline have difficulty concentrating. We're not going to make them like all the other kids, right? As long as they're back to their baseline, then they can start returning to
Okay,
play. But they can't just go right back to everything they were doing without starting to ramp
sure.
up. So, a lot of our athletic trainers in the high schools and even sports docs will like counsel patients and their families on how to return to play. So it's going to be like light jogging, making sure you don't get symptoms like dizziness or headache when you're jogging, then sort of ramp up like sprinting. Can you do, and at the very end, you'll be doing more contact. So for moms that watch like NFL football or even college football, because college football is probably more popular, I think. Everyone has their allegiance to
I
their
know
college
their
team.
teams.
They'll say, oh, they're in protocol for concussion. That means that they're being watched for symptoms and that they're actually trying to start to get back to playing. So that's going to be the running, lifting, all of those things to make sure people aren't symptomatic.
Okay. So, Dr. Goto, for those of us who are kind of that first line, like, you get that call, hey, this happened at school. Can you evaluate my son? Um, when should we order imaging? Is imaging ever indicated when you're considering a concussion?
Yeah, so unless there's signs of like a neurologic, what we call a neurologic defect, right? Like maybe the eyes don't move correctly, or there's numbness or tingling or weakness somewhere, you really don't need to be doing imaging
Okay,
initially. For some of our kids who maybe have prolonged symptoms, like many weeks to months, and they just don't seem to be getting better, or maybe they have new headache after the concussion, and you're like, that's kind of weird, then I would maybe think about imaging. But for the large majority of concussions, you do not need to do imaging.
sure. Any medications that can help?
Yeah, so the medications are really going to be for symptoms. Initially, in the first 48 hours, we do not recommend things like ibuprofen or naproxen because of the bleeding risk. But after that first 48 to 72 hours, you can use that. Tylenol is always a safe bet. There's been some newer research that suggests that maybe fish oil can be helpful for brain recovery. Most kids don't like fish oil because it causes fishy burps. Um, but if you really wanted to do the fish oil, I do recommend putting the capsules in the freezer because it helps to eliminate the fishy burps.
Sure, sure. So, you mentioned early on that concussions are actually considered like traumatic brain injuries, right? And
Mhm.
for us docs, behind the scenes, we know like when we hear traumatic brain injury, we know of the long term effects. typically
Mhm.
associated with what we call TBIs, traumatic brain injuries. So, can you talk more about that and what you guys see with the kids long term? Yeah.
Yeah. So we don't really have a lot of good long-term data. Like we don't know how many concussions is too
Right.
many because every concussion is different. Certainly, there's a lot of scary stuff out there with some former NFL players. Do we know like how much of their childhood, hits to their head or
Right.
concussions played into that? We don't really
Right.
know, right? I think that data is still coming, and I think it's going to take us a little while to really figure that out. And also keeping in mind, everybody's different, right? We don't know, does it matter when your first concussion was? Does it matter how many, how bad the symptoms were, how long it took you to get
Right.
better? For a lot of kids, though, if you have a lot of concussions, we might need to think about maybe is this the right sport for you?
Sure, sure. So you're saying if I'm that mom, I'm, really pushing my kid to get into the NBA. Well, mostly it would be like the NFL with, those head injuries. But I'm really pushing him. Um, what would you personally recommend? Um, in terms of like the risk of concussions, do you recommend um certain sports or going away from certain sports? Like we know there's a higher risk with football, because it's contact. um what would you, as a specialist in sports medicine, family medicine, what do you tell your patients?
Yeah, I don't think I would limit someone to different
Okay.
sports. I think it's a really personal decision. So I live in Hawaii. High school football is really popular here. Kids start playing like tackle football
So
from the
you
time
wouldn't be
they're
the
in
popular
elementary
doctor to
school.
say don't do it.
Yeah. And I think honestly, football can be really safe, right? If kids are learning proper tackling technique with good coaching, if they have the proper training, strength training, right? If they're not doing contact every single day, that limits your number of opportunities for kids. So I think there's a safe way to play contact sports, but it really, I think, comes down to having good technique, which is hard when you're a kid. You're just excited
Exactly.
to play. You're like, I'm gonna hit someone, which I often hear at my high school. Like you hear parents go out and hit someone. I'm like,
That's
no.
not what we want. Yeah.
I mean, yes, but safely.
Right, right. To win,
So
I
I
guess
think
we need to
doing
do it. I guess, but
Yeah. And I get it. There's some parents who say there's no way my kid's going to play contact sports, and that's totally fine. That's up to them. But I think there are safe ways to play contact sports, and there's always a risk. We can't protect our kid 100%.
right, right. So, tell us more. It's exciting to be a sports medicine doctor. Can you tell us more about what you're like when you mentioned that you're the doc for a high school team? Can you tell us like game day, what that looks like, and get us into the exciting things that go on behind the scenes?
Yeah, so Hawaii is a smaller state, but we do have quite a few high schools, and not enough referees. So we usually split our games. Some high schools play Friday night and some play Saturday night, and it just depends on the schedule.
Mm.
So Fridays for me are usually kind of a rush because we start our JV team at 5 p.m. and I finish clinic at
Oh
4:30.
wow!
So I'm usually a little late, but I try my best
Sure,
to get
sure.
there on time. Usually I'm sitting in traffic going, oh my God, I'm really
Yeah.
late. Oh my God, they're probably at halftime.
Hopefully not.
Um, but JV's a little shorter. Their quarters are a little bit shorter than
Oh,
our
got
varsity
it.
team. So they go a little faster.
Got it. I
But
understand.
usually I get to the field. I'm really lucky because I work with two really amazing athletic trainers, Chelsea and Joel. Shout out to
Mhm.
them. They're awesome.
Nice.
Um, they do a lot of the hard work. So they do the taping, making sure kids are progressing through whatever rehab they're doing during the week. And I just show up for game day.
Mm.
um, And so on game day, if there's an injury on the field, I don't typically rush out there because usually it's like a cramp, which the trainers are more than equipped to
Sure,
handle.
sure.
If it looks like it's maybe more serious, then I may sort of wander out there, sort of do the dance of do I go out there, do I not? Chelsea and Joel will usually, if they see something that's very concerning, they'll usually wave me over.
Okay.
Um, and for for me, and everybody's different.
Right.
For us, I usually like to see like, can the kid get to the sideline? Because let's keep the game moving.
Right.
We don't want
Right.
to be here all night.
Right.
And so if they can get to the sideline safely,
Mm.
um, then I'll evaluate them on the sideline. But if it's something serious, like we've had, a broken leg,
Hmm.
we had an elbow dislocation last year,
Okay.
those we have to take care of on the field.
Right.
So people just have to be patient with us. But for the most part, when we evaluate injuries, most of the kids, it's not anything serious. The parents do usually come down to the fence. There's a little fence that separates the bleachers from the field. And usually the trainers will talk to the parents because they know them.
Sure.
And then also let the coaches know, like, hey, can this kid play or not play?
Okay. Okay. Have you guys ever had to emergently take someone to the emergency room or wheel them off or from the
Yeah,
field, right?
so actually the very first game I covered for this high school, we had a broken leg that needed to be splinted. Like we had to call EMS, and
Oh,
at a lot of places, EMS will be at the field,
sure.
but in Hawaii, we're such a small community
Mm.
that we don't have enough, as sad as it is, we don't have enough EMS to be dedicated to all those games
Mm.
on a Friday and Saturday night. So luckily, the fire station is right down the street from our high school. So we actually had to call the ambulance and wait there, and we put the kid in a splint, and
Okay.
we basically just hung out on the field for a good 20 minutes.
Aw. Aw, I can
Yeah,
imagine
but
how
that kid,
they're tough
yeah,
though.
he did come back
Yeah.
though. He did come back the next year, played because we played that team again.
Yay. I'm
Yeah.
happy. I like happy endings.
Yeah.
Yeah.
Most of our kids do really
Mm.
well. I mean, I don't think I've ever had a kid who people have season ending injuries, but usually if they're coming back, they're usually okay to come back.
Okay. So, Dr.
Yeah.
Goto, in summary, can you tell us what you would recommend to a mom who has a kid who plays contact sports?
Yeah.
Yeah,
So depending on the sport, one thing that's really important, like I mentioned before, is making sure you have good technique. So
sure.
specifically in football, we want to make sure kids are being coached by coaches who have training, right? Not just like Joe from down the street. Because there's special training, for tackling technique. We don't want kids leading with the crown of their head because that puts a lot of strain on the spine. We want to make sure that kids are tackling correctly. Obviously, things happen, things that we can't always expect, and things happen really fast. So we can't always prevent everything. The other thing is making sure you have like the correct protective equipment, right? So if you're playing tackle football, you should have the correct pads, obviously a helmet. There's been a lot of data recently, and a lot of people are asking about the Guardian caps for concussion. We saw it in the NFL.
Okay.
Um, we don't know that it's that helpful for high school kids specifically because the models are different between the NFL and collegiate model and the high school model.
Okay.
And there was actually a study that was published in January of 2025 that showed that there was no difference in concussions with that.
Okay.
So, I mean, maybe down the line there might be something that
Mhm.
helps, but really it's the brain moving inside the skull, right? So unless we can limit that, I don't know that external things will be all that helpful.
Right. Right.
um yeah, and then the last thing is conditioning, right? Or second to last thing, sorry.
That's okay.
Conditioning,
We'll take whatever you give
making
us.
sure your making sure your kid knows how to play the sport, is in shape, right? Because as you get more tired, your technique starts to decrease,
Right.
right? You're not going to have good technique because you're tired.
Right.
And then the very last thing is awareness, right? So making sure that you and your coach and your kid know the symptoms of a concussion. If they get hit, or even if they didn't get hit, they just got jostled around, they're like, oh, I don't feel good. I feel a little queasy, my head doesn't feel right,
Right.
they need to come out of the game
Right.
because we don't want them to get another hit and get worse.
Sure, sure. That's awesome. Thanks for that. Yeah. And then for the family docs or the ones who see those kids before they get to you guys. I know, sometimes the athletic trainers see them, but I know having worked urgent care in the past, I would get a lot of patients
Yeah.
who come in. What would, if you had a chance to talk to us, what would you tell us?
Yeah, I think that primary care docs and urgent care docs are really, really capable of handling like straightforward concussion, but
Okay.
it is never wrong to send someone to a sports medicine specialist who deals with concussion on a really frequent basis. If you're ever concerned, I would say pick up the phone and call one of us.
Okay.
Or for me, texting is easier because I'm usually with patients, so I can't always answer the
Right.
phone.
Right.
But I don't think it's ever wrong to ask for help from your specialist. There's a bunch of different tools that you can use that I use actually to help me keep track of symptoms and how kids are progressing. And then the other thing too is those athletic trainers at the high schools, they are gold. They know so much about the kids,
Yeah.
more than sometimes I feel like their parents, because they see them often.
Right.
And so they can also be helpful in saying, like, hey, yeah, even though this kid's saying he's having trouble concentrating, this is like his normal, right? Because sometimes teenagers, especially, they're not always that aware,
Sure.
or they're not sure, or they get nervous, right? Because they've never had an injury before where they couldn't play. And then now they're really anxious about or feeling nervous about what their body's doing.
Okay. Any tools we can use to evaluate? You did mention there are certain tools. Yeah.
Yeah, so I like to use the SCAT. It's available for free online. It's, I believe it's one page, but mostly what I use it for is the symptom score. So the symptom score has like a list of, I think it's like 26 symptoms, and they rank them or they have like from mild to severe, and you add it up. And I think that's a really nice way to follow the symptoms, um, to make sure that they're improving. There's some other information on that form, like asking about history of like dyslexia or ADHD, mood disorders, which can be helpful, but not necessarily like necessary for doing like the symptom evaluation.
Okay. And what
Yeah.
number is it now? I know there are different versions. Like there was five, four, and
Yeah.
five. Where are we at now?
I think we're on, in my office, we have SCAP 5.
Five. Okay, so it's still
Yeah.
five.
Yeah. Yeah.
Thank you for
So,
those resources.
yeah.
I'm glad. I know we have a lot of doctors who listen to the podcast as well, and they'll find this helpful. But
Yeah.
Dr. Goto, this was so needed, and so informative. Thank you for your time.
Yeah.
Thank you for your wisdom for our patients who are in Hawaii and our patients listening who would love to work with you via telemedicine, maybe. How can we
Mhm.
find you?
Yeah, so I'm on Instagram at Dr. Kiyomi Goto. My website is being built, so there's nothing there yet.
Sure, sure. Um, and and are you open to telemedicine?
Yes, so
Okay,
I am licensed in Hawaii and Pennsylvania.
okay.
So you have to be in one of those two states.
Okay, okay.
Yeah.
Guys, you heard it. You heard it. Dr. Goto, she's open wherever you are, especially for our listeners in Pennsylvania. If you ever need a sports medicine doctor, she's the one. But yes, Dr. Goto, thanks so much again. It was truly
Yeah.
a pleasure having you in the care room.
Thank you so much, Dr. Cindy. It's so good to see you and chat.
Yes, always a pleasure.
All right.
Until next time.
Bye.
Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice. treatment, or diagnosis. Always, always consult your personalized healthcare provider for medical guidance.